Hi, good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With me today, we have Dr. Samia Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Fulshew, who is our Director of Epidemiology, and Nicole is our ASL interpreter. Thanks, everybody, for being here. Dr. Ariola, I thought maybe you could talk about maybe this week's plans and what kind of appointment availability we have.
Thank you, Jody, and good afternoon, everyone. This week we have clinics that are planned for tomorrow, Wednesday and Thursday, 9 a.m. To 7 p.m. We also have a clinic that's planned for Saturday, 9 a.m. to 12 noon. There's a lot of appointments still available this week. Tomorrow is completely filled. The 3,000 appointment spots are booked, but we do have appointments available on Wednesday afternoon, as well as the all day on Thursday. So if you are yet to get vaccinated, this is the time to book the appointments now. I'm also aware that our partners have a lot of appointments open. Our health systems have appointments open, pharmacists have appointments open, and we are already pushing out vaccines to private providers in the county also. So there are so many opportunities to get vaccinated, but right now, if you haven't been vaccinated, we have appointments. There's no, not having appointments available is no longer an excuse right now, because we have appointments in the county. I would note also that as our appointments are for the mass vaccination clinics are ongoing, and the demand for them are not keeping up like they used to be. It's very important for our residents to understand the many other activities that are ongoing. We are vaccinating small groups. I'll continue to do that. And we are going to increase that in the next 1 to 2 weeks. We are going to be unveiling even more detailed plan about how to have smaller vaccination clinics all over the county. And so we are going to be working with churches, going to be working with other organizations in the community, and ensuring that those who need to be vaccinated are vaccinated. We are asking our schools, junior colleges, we have appointments open. Employees, we have appointments open. And Elizabeth is going to talk very soon about some of our efforts in vaccinating in 16 to 18-year-olds and our high schools. All of those are ongoing. So while the need for mass vaccination clinics may not be as important as it was 3-4 weeks ago, there's a lot of activities going on that we want to be clear, to be sure that people understand that. But there are appointments that are open. People can get vaccinated right now, and the plan continues for next week. Obviously, depending on the uptake of our appointments, we're going to be making some adjustments to the clinic. But those are things that we haven't made any definitive decisions, and whatever decisions we make will ensure that those are communicated early enough for people to make adjustment. But our goal remains the same. It is to provide opportunities, multiple opportunities, so that our residents can get vaccinated, so that we can get vaccines into the arms of as many people as quickly as we can. That hasn't changed. That will continue until we get to the so-called herd immunity or population immunity or community immunity. I prefer now to use population immunity. That's the goal. That's where we want to get to collectively. Getting vaccinated is good for you. There's evidence there that it protects against death, hospitalization, severe illnesses. There's evidence that even though we have a few breakthrough infections, there's evidence that it helps protect others from you, that you are not as infectious, you are not spreading the virus to others. So getting vaccinated is not, it's so much of a benefit to yourself, but it's also as part of our responsibility to others. If I get vaccinated and I spend time with my 83-year-old mom, I know that she is getting protected. I'm not putting her at risk. That's one reason to get vaccinated. Second reason to get vaccinated is for yourself, to protect you. Third one is out of a responsibility to the community. If we get to that population immunity, which entails for us to get a higher percentage of our population vaccinated. Some estimates have that as high as 80, 85, 90%. I'll be very happy if we get to 75%. We're still ways away from there. So that reason is out of a responsibility to the community. We're in this together. If we do that, we get to that point, we break the chain of transmission. We protect ourselves, we protect others. There might still be sporadic cases, but it makes it easier for us to manage. And guess what? The added advantage, if we get to that point, is that we snuff out the ability of this virus to mutate. The more people that the virus is infecting, the more we give the virus opportunity to mutate. And the more mutations, the more different variants that we have, the higher the opportunity for our vaccine to not be as effective anymore. Now we do know that the predominant species in the United States now is the so-called UK variant, the B.1.1.7. We know that our vaccines are proving to be effective against those. May not be quite as effective against the South African variety, and there could be other mutants out there. So we need to be very, very careful. So it's not just getting there, it's getting there as quickly as we can. So get yourself vaccinated. The opportunities is there. 2 months ago, the issue we had was supply. Right now, it's not supply. We have the vaccine. Appointments are there. Again, get yourself vaccinated. And let Elizabeth talk a little bit about the vaccination efforts with the high school and 16 to 18-year-olds.
Thanks, Dr. Ariola. One other piece I'll add to reasons to get vaccinated, even if you've had COVID-19, there is some protection that you get just by having the infection. But what we know is that when you get the vaccine, it actually produces an immune response about 10 times greater than that of a natural infection of when you just catch COVID-19. And this is really important. We actually heard today about one of our residents who was infected with COVID-19 about 4 months ago and thought, I had the infection, I'm fine, I don't need the vaccine. Unfortunately, this individual is now in the hospital with a new infection of COVID-19, and stated that I thought I was fine, I didn't need it. So, even if you've had COVID-19, even if it's been recently, the vaccine does provide additional protection against the virus. And so we would definitely recommend you go ahead and get vaccinated. There's no time that you need to wait once you've done your 10 days of isolation. So stay at home for your 10 days once you start having symptoms. And then once you get out of that 10-day period, you can get your vaccine as soon as possible. So I would strongly recommend people do that, even though they have had that natural infection. As for our 16 to 18-year-olds, we've been working with our school districts, obviously, since last summer in preparation of school opening. And trying to keep our kids safe through contact tracing and case investigation within our schools, and then vaccinating all of the staff who work in our school districts and our private schools. And now it's time for the 16 to 18-year-olds to get vaccinated. And this looks very different depending on what school district your children go to. For Shawnee Mission, they will be vaccinating students during school hours this week, starting tomorrow. This is completely voluntary. Families were asked last week if they would be interested in this. And then on Friday, they received an email with a consent form for that to be done during school hours. We have another school district who is looking to do a vaccine clinic on the 1st of May for their families. And so information on that will be forthcoming. And then for the other school districts, because it is quite a big lift to have staff to be able to provide vaccines, to have the time and all of those pieces. So our other school districts have opted not to run clinics on their own. And there were several conversations, and I talked about it on here, that we considered doing an independent clinic for just 16 to 18-year-olds at one of our sites in partnership with Children's Mercy. But honestly, with the number of vaccine appointments that are available in the community, both at our site, at Children's Mercy, as well as our hospital partners and pharmacies. We opted just to move forward with providing information to families throughout Johnson County about the various vaccine opportunities. So you should, if you have a child who is between 16 and 18, you should have received that information from your school. But if you didn't, you can find vaccine appointments a couple of different ways. So for our clinic, you can go to jocogov.org/COVID vaccine, and that will bring you to our appointment scheduler. It's very simple now. No long surveys to fill out like we were having people do early on during our vaccine rollout. All you have to do is go on and find that date and time that works for you and your family and book your appointment. Children's Mercy also has two clinics that they are running. The first one is Wednesday, this coming Wednesday, from 2 to 8 p.m. at Children's Mercy, Kansas, over right around Knoll and 435. And then they also have another clinic on May 1st from 8 a.m. to 2 p.m. And so if you just Google Children's Mercy COVID-19 vaccine, their page will come up. And you can do that two different ways. You can either log into your My Children's Mercy patient portal if you have one of those, or you can call their call center, and that phone number is on there. Additionally, on our website, there are all of the different links to our various partners who are providing vaccine, and most of those are administering Pfizer, which is the only vaccine that is licensed for those 16 and up to 18. So lots of opportunities. We definitely would recommend that students at this age get their vaccine. They are in the community. They're oftentimes working or going to athletic events or any number of places, as a lot of teenagers do. And so this is the best way to get them protected, as well as to protect those around you who either can't get the vaccine or who may not be vaccinated yet. And it also helps keep our kids in school. So, although the 2 weeks after the second dose will be coming right at the end of the school year, if they're exposed, they won't need to quarantine, which is a nice benefit as long as they stay asymptomatic after that exposure. So lots of benefits, again, to yourself, to the community, to your loved ones. So certainly would recommend going ahead and doing that. Like Dr. Ariola said, lots of appointments available all over, whether you want to come to us or you want to come to one of our partners to get vaccinated.
Yeah, thank you, Elizabeth. And Jody, before we start taking questions, I do want to point out a few things on the data, just to show the incredible efforts that has been ongoing for the past 3.5, going to 4 months now since we started vaccine distribution. If you look at our website where we showed the data, and I'm not updating the WebIZ data that Elizabeth pulls or gets every Wednesday, just the bottom data from Insight. While again, understanding that our data entry lags a little bit, but understand that thus far at our clinics, this is showing that we have given over 85,000 shots. I know that it's a lot more than that, but more importantly, over almost 51,000 of our residents have received their first shot at our clinics, and 35,000 have received their second shots at our clinic. When these are updated, these numbers are higher than they are. We are pulling in more resources to get those data entered up to date, but very, very impressive work going on around here. And we want you to be a part of that. We want to count you. We want to, again, even if you don't get your vaccine from us, get it from our partners. We want to get the vaccine into your arm. So yeah, we're happy to take any questions that you have, Jody.
One quick question. So if there's someone out there that's watching that maybe is, interested in the vaccine, but they're just kind of waiting to see, are people getting sick off of it? What's happening in our community? Can you talk about sort of in the clinics you're running, how often does somebody have an adverse reaction? How typical is that?
It does happen. That's why we ask people to wait 15 minutes, and then we have medac personnel there. But it is pretty rare. It is pretty rare. Most of the ones we saw, especially when we were administering that to the older population, seems like ages ago, but our goal at the start was to protect our most vulnerable population. So we started up focusing on our 80 plus and then 65 plus. Does happen is the exception. Now, there are some side effects that you will get from getting the vaccine. Most of them related to the site of injection, pain, swelling, those happen. Now, beyond that, people have reported headaches, chills, fever, all of them transient. None of them absolutely different from what you would from getting other types of vaccine. In some very, very rare cases, which we've talked about, we have seen people that showed allergic reaction, anaphylactic reaction. Those are very, very rare. I haven't looked at the data recently, but the last time that we checked, it was about 4.1 in Moderna, about 2 point something in Pfizer, combined to collectively about 2.5 per million persons that have taken this. We have given these vaccines now to millions of people, tens of millions of people. And if you count first and second doses, we are at about 190 million doses given, first and second, of all the vaccines together in the United States. And so, yeah, that's a lot of data. I haven't seen data that much in my life. So that's good. If anything was happening, we would have picked it up. And I do want to touch again on the news last week about the J&J. Dr. Fauci said, very similar to what we have said last week, we expect the pause to be very short, and we expect the vaccine to be available. There could be some modifications as to who takes it, and but the biggest thing is to ensure that our medical providers are educated on looking out for that and how to treat that, especially since heparin is not indicated for this. So we expect that it's a good tool. It's a primary tool that we use in specific situations. So we are looking forward to that. But overall, the best vaccine is the one that's available to you. We have some really good vaccines that are out there. And a couple of things to dispel. The technologies that are employed in both the adenovirus or the mRNA vaccines, we've been working on those for years, okay? The adenovirus vaccine, this is not the first vaccine that was made with it. The Ebola vaccine was made with it. Now, the technology for the mRNA vaccine been working on for 10 to 20 years, so it's not new. It is just being deployed for the first time. And when you have given that shot to millions of people across the world, data supports the efficacy, data supports the safety. And so while I understand that people have questions and there's some level of personal decision that are there, I think that's the message that people have to know. It's not something that we've only administered to 10,000 people or 20,000 people. It's been administered to millions of people, first and second doses. You can't script that any better. The data is there, it supports the efficacy and it supports the safety.
And the fact that we have a platform, VAERS, VAERS, the Vaccine Adverse Event Reporting System, this is how we track those side effects if there are anything concerning. And that's where the researchers and the scientists from FDA and CDC saw the alarming signs or the potentially alarming signs with the blood clots and J&J. It's and these are not just for providers. I actually talked to a family member who had had a health concern shortly after their first dose, and they were calling me looking for advice. And when I talked to them, they'd already actually gone on and submitted a VAERS report for themselves because they didn't think their provider had done it. And that's absolutely what the system is for. Whether, if you have a reaction and you want to go on and report it, or something you even think maybe is associated with it, even if your doctor does that too, that's okay. And that allows for FDA and CDC to monitor whether or not there are any concerning side effects or reactions. It's definitely out there. If you feel like you've had something, feel free to go on. You can just Google VAERS and it will come up. And so that's the way that we track these as a nation to ensure that the vaccines that we roll out are safe and that there aren't anything very rare that we usually won't see until a large number of people have been vaccinated.
Okay, great, thank you. We have a question on Facebook. Did I hear you say that when you're vaccinated, you cannot pass the virus on if you get it?
So let's be clear that that was not part of the original study. Okay, so the science or evidence around that is evolving. So nothing is definitive, but we do know that you have reduced ability to. Now, whether you absolutely cannot pass that on, we don't know that. I think that's why we're asking people to continue to wear masks out of caution. It is possible that while your viral load might be low and you might be asymptomatic, it is possible to still be able to pass the virus.
Thank you for answering that question. Um, and I'm not really seeing any more questions, so I just wanted to see if there's anything else you'd like to cover today before we close.
Yes, Jody. On Saturday, we received the really sad news about the previous director of the Johnson County Department of Health and Environment, Eugene Marsh's transition. Eugene was the first person that I contacted when I accepted this job. She has been a tremendous support, and just sharing the news and getting feedback from staff and other public health persons in Kansas. The words that are coming back are consistent. She is a great public health champion. She did some great work, and you look at the department to see some of those. She got the department accredited. All of the basics of health equity, health disparities, strategic planning, all of those key things to public health, she was integral. She understood and she put attention to that and resources to that. She retired, but even in retirement, she did not stop working. She was part of the COVID response, working with the state, and I exchanged a lot of messages and questions. In fact, when I was looking for vaccines in January, I reached out to her and was like, "Can you explain to me why we don't have enough vaccine in Johnson County?" She just was tremendously supportive, tremendous knowledge. So while we are losing a very nice person, we are losing a lot of institutional knowledge. Her breadth and depth of understanding of public health issues is a loss to the community. And so talking to all of our staff, I would say that on behalf of the Johnson County Department of Health and Environment, where she served for about 10 years, that we are extending our condolences to our family, the family that she left behind, mom, husband, and children and grandchildren. She was tremendous. She will be missed.
Yeah, and I'll just chime in. I actually met Eugene about 10 years ago when I was just a baby epi working for the state of Kansas, and I was in an Emerging Leaders Academy course, and she came in and talked about Johnson County and the work that was going on here. And I'm not from the state. I didn't know much about Johnson County, but I was so inspired by her and the work that was going on here that I told myself, even a year into my career, if I was ever to move to a county health department, I wanted to come to Johnson County. And about 5 years after that point, that came true. And I started working here and learned so much about local public health, which is very different than working at the state, from Eugene. Dr. Ariel is right. Her breadth of knowledge and passion for this community was unparalleled. And so I learned so much about both the community as well as how to do this work and how to really make that impact that she was so keen on. And so she is just tremendous individual, has an incredible legacy here with the Department of Health and in Johnson County, and will be missed. So extending our condolences to her family and all of the people who worked with her throughout Johnson County and the state.
Well, thank you both for sharing your thoughts on her, and just know that the incredible work that you do every day is a tribute to her. So thank you for all you do. And again, thanks for sharing those thoughts. Before we close for today, I just had one item of housekeeping. So moving forward, starting this week, we will be doing these Facebook Lives on Mondays and Thursdays at 4 o'clock rather than every day. So again, just Monday and Thursday, and we'll put out reminders on social media the days that we're doing them. So thanks for watching, and thanks for being a part of them. Dr. Ariola, Elizabeth, thank you so much for the information you shared. And Nicole, thanks for being our ASL interpreter. And everybody have a great rest of your day. Thanks a lot.